Welcome back to the Diet Doctor Podcast. I'm your host, Dr. Brett Scher. Today we have a real treat. We're joined by Dr. Andreas Eenfeldt, the Diet Doctor himself, the man who took Diet Doctor basically from as a solo primary care doctor in Sweden to creating a blog in Swedish, to creating a website in Swedish, to then growing it into a 60-person company that has become the leading online source for low carb and keto information, and now transitioning to the leading source for healthy weight loss information in general. And it's really interesting to have this discussion with Andreas to talk about sort of the evolution of Diet Doctor and how that has gone with the evolution of nutritional science. And nutritional science is complex, and we've talked a lot about it before. But we have to sort of balance what does the science say works? What does science say about how it works? And then what is that individual personal experience? And those sort of 3 points of trying to find what diet works. And we can't say one diet works for everybody, right? There's this mix of the general concepts of what works in nutrition and what works for individuals, and addressing hunger and addressing satiety and addressing the emotional part and sticking to the science, and all that coming together, and how this has led to sort of an evolution in Diet Doctor. And the initial tagline for Diet Doctor was making low carb simple. And there's nothing as simple as lower your carbs and eat more fat. But it gets more complicated than that, because we have to admit that nutrition isn't simple and people aren't simple. So still trying to keep the message simple, but keeping it accurate and as helpful as possible. So we talk a lot about that in this interview. And some of the things we talk about more deeply in episode 69 of the podcast, when I interview Andreas and Adele Haidt and Franziska Spritzler about sort of the protein message and the satiety message and what the science says. So if you're interested in more details about that, please go back and listen to episode 69. But for this episode, let's get into these details and hear from the man himself, Dr. Andreas Eenfeldt. Andreas, well, welcome back to the Diet Doctor Podcast. I'm excited for you to join me today.
Well, thank you, Brett. It's a pleasure to be on.
Yeah, I think it's great that we take this opportunity to sort of look back at the past of Diet Doctor, sort of how Diet Doctor has gotten to where we are today and where we're going in the future. And I think this information will really help people understand more about our message and more about how we're trying to help them. So let's just jump right in and talk about your beginnings in Diet Doctor. And I think it's such a great story. I mean, anytime like one doctor can change their life and develop a company like this, to me is fascinating. So let's hear a little bit about your path and what led you from being a family doctor in Sweden to say, I think there's more I can do here. Give us a little of the backstory.
Yeah, I mean, sure. I mean, obviously now it's a lot of people. There's a lot of people involved. We're like 60 people in the company now, so I can't take credit for much of what goes on anymore. But back a long time ago, it was basically just me. So sure. I mean, I started out, as you said, as the family doctor. I got really obsessed about lifestyle and diet specifically, and health, because when we're in med school, we had perhaps 1 week of nutrition training, and
right.
We didn't learn much of value, I would argue. And yet, when you work as a family doctor, you're meeting all these people all the time with type 2 diabetes, hypertension, obesity, etc. It's like a big part of what you do, and it just became clear that the advice we're giving to people may not be the best. So I read a bunch of books. I read a lot of studies, basically pointing to the fact that, if you reduce the sugar intake, the carbohydrate intake, then all these things can improve. And when I started doing that with patients, it really was a transformational moment for me, because, I'm used to as doctors to just, people come in and they may need medication for high blood pressure or type 2 diabetes, etc. And, these are not medications that just, you take them for 10 days like an antibiotic, and then the problem is gone and, everything is good. No, it's like you take them for life, and next year you're probably going to increase the dose and add another medication perhaps. So the spectacular thing when, I managed to empower some people to change their diets is that something entirely different happens, right? People come back, and blood sugar used to be super high perhaps, and now it's normal. Blood pressure used to be high, now it's normal. It's like, wow, and they're lost weight and they're happy and they're smiling and saying, why did nobody tell me this before? And, started bringing me gifts. And, it's just a great thing. But there, as you know, there are two big problems with this. And the first problem is that it takes a lot of time and passion to do this as a doctor. Most doctors don't have the time or the resources. The system isn't set up, for that. You have 5 or 10 minutes. And then the other problem is even if you do that, then, it's not scalable. You try to help one person at a time. You never make a dent in these numbers. So, yeah, because of that, I started a website, a blog in Swedish. And it took off. A lot of people found it helpful and became the biggest health blog in Sweden within a year. Wrote a book that became a bestseller, and then just snowballed from there, I guess. This website became more popular, hired some freelancers, built a sort of subscription service for some more premium content, got real revenue, and started hiring full-time people to help develop it. And here we are, today, 14 years later, I guess, just step by step, bootstrapped all the way here. So it's been an exciting journey.
I mean, that's a great answer, and an answer that we hear kind of frequently from people about when they encounter specifically a low carb lifestyle change, that people say, why have no one ever told me this before? And you see things as a practitioner that you've never seen before about taking people off of medications and seeing their improvement. So you then sort of jumped in to low carb head on and made your website the biggest and most popular low carb website kind of in the world. And what was that trajectory like for you as you're going through this process of spreading the message of low carb? Specifically, like, how did you see the landscape of low carb change during that time frame?
Yeah, I mean, it sounds like it's just this quick thing, but of course the reality is this long journey of, I guess lots of mistakes and, things that didn't work out, and then trying to improve and learn and do things better. I mean, this was over years and years and years, really. But yeah, it's been a learning journey. It's learning what works, learning how to make it simpler for people to implement this kind of thing in their lives, because it's not simple, right? People come from a position where, and the same is true for me, where, you have a certain idea about what is healthy food. It's, low-fat foods and, vegetables and fruits and whole grains. And, these are the ideas, I guess, most people have had, at least at some point, if they don't still have it. So going from there to a lower carb diet that is perhaps higher in fat and even higher in saturated fat and lower in whole grains, I guess it takes some time to get used to that idea and try it out and see if it works for you. So, yeah, I mean, this is something I did over many years myself, I suppose, going to like a less sugar, less processed carbs, low glycemic index diet, and then saying, okay, maybe actually even add some fat, and then maybe actually even, saturated fat may not be something to worry about. And yeah, so it takes time. And helping to guide people on that journey a little bit faster and make it a little bit simpler and faster is, I guess, what we try to do here with our website and services.
Right. And that's the tagline, making low carb simple, right? That's a big part of Diet Doctor's message. And on the one hand, it is complicated. It's hard for some people to get rid of the carbohydrates and to get rid of the sugars, and hard for them to add fat, at least initially. Sort of cognitively, it can be difficult. But the message is still pretty simple. Reduce your carbs, increase your fat. Like, it doesn't get much more simple than that from a message standpoint. And initially, for a lot of people, that works wonderfully. But it seems like the trend in keto has sort of changed over time, and Diet Doctor has adapted to that change. So tell us a little bit about the progression of just lower your carbs, eat more fat, to the message getting maybe not quite as simple, but following the science, following the clinical experience to help more people. So tell us what you see about that trend over time.
Yeah, I'm not sure it's so much about following a trend. It's more like following the science and following the best available experience about what works, right? And sure, you could say that, oh, it's a beautiful, simple message to say just eat fewer carbs and more fat. Well, what if it doesn't help people to optimize their results? What if people get stuck in a weight loss plateau or they don't really get the results that they want? Then it's not so simple, right? So I don't think it's about making the message as simple as possible. It's making it as simple as possible to get the results that people are looking for. I think clearly, in hindsight, with the low carb and keto movement, may have gone a little bit too far into the sort of high fat territory. If we're supposed to stay in alignment with the best available research, especially in the last few years with the studies coming out. I mean, I certainly come from this sort of carbohydrate insulin model framework of thinking where, carbs raise insulin. That is what drives fat storage, and therefore, lower carbs is always better, and increasing fat doesn't seem to be a big concern from that model. But I think that model isn't, that model is kind of flawed, and it's perhaps not the best framework to look at the situation through. For example, if you're looking at all the studies that show that a low carb diet works wonderfully for a lot of people, for a lot of metabolic problems, what you see is that in these studies, pretty much universally, they also increase the protein amount. If you remove most carbohydrates from your food, you tend to eat more of protein-rich foods such as meat, fish, eggs, etc. So it becomes a bit challenging to say, is this effect all due to reducing carbs, or is it from increasing fat, or is it from increasing protein? Can't really say from those studies. And then there are a number of studies pointing to the fact that maybe increasing protein is actually a key part of why low carb works so well for a lot of people. And if that's the case, then the message maybe has to be tweaked a bit to make it as effective as possible for as many people as possible.
Yeah, so now all of a sudden you're introducing quite a bit of nuance, and some people would say complexity into the message. But I get your point, right? If that's what it takes to help people succeed the most, then it makes sense. That's what the message should be. And if that's what the science reflects, then that's what the message should be. But it seems like, especially with nutrition, people are in their camps, right? You mentioned the carbohydrate insulin model. So you're either in the carbohydrate insulin model camp or you're in the calories in, calories out camp. With keto, you're either in the high fat camp or you're in the PE diet, high protein camp. And it seems like there's been sort of this polarization of beliefs. And I'm sure you've seen that transpire over the years that you've been involved in this. What are your thoughts on that type of polarizing society or polarizing situation in nutrition?
Yeah, I think it's super interesting to reflect on. We humans, I certainly include myself in that sort of group. We have this tendency to, like you said, we belong to a camp, and it's almost like we're cheering for our own team. It's like a team sport in a way. But that's not the way science is supposed to work. With a scientific mindset, you're supposed to say, hey, I could be wrong about this. Maybe there is something I don't know. And other people may be wrong as well. Let's look at the data. Let's do experiments and look at the results and see, okay, maybe we can learn something new here. And I think that's the mindset that we should approach this with, a scientific mindset. And then, if you find out that actually the carbohydrate insulin model is flawed, just like the calories in, calories out model might be oversimplified and not really helpful for guiding people's lifestyles, then you need to learn and adapt, right, your message.
Right.
Even if it means that you're now no longer perfectly in alignment with some team of some kind on Twitter, I try not to care too much about that, actually. Looking for the truth, right? Or at least to get close. The truth is unattainable, this perfect thing that you can never really get to, but you can at least aim to get closer to it over the years.
Yeah. And it's interesting the way you said it, though, that the carbohydrate insulin model is flawed. Not that it's dead, not that it's wrong, not that it's just something we should completely ignore, but it's flawed. It doesn't explain everything about weight loss. It doesn't explain everything about how and why low carb works. So I get from your answer that you think there's still a component there that is important. Carbohydrates and insulin matter, but it's not sort of the end solution. Is that what you mean by when you say it's flawed?
Yeah, I wouldn't go so far. Some people call it dead. I think that's overstating it probably. I think there's probably value in it. It's just it doesn't fit all the data. It doesn't really tell you what you need to know in every situation.
Right. So I think that's important. Again, that's the nuance and the complexity that makes the message not quite as simple, but it makes it on the path to being sort of more accurate.
I mean, like for example, I mean, there's so many examples, but for example, the carbohydrate insulin model would predict that people who eat a lot of carbs, they should struggle with maintaining a good body weight. But in fact, there are many, different people who eat a very high carb diet and they're super lean and super healthy. Certainly a lot of groups of people, Kitavans, etc., but also like fitness professionals. Some of them eat very high carbohydrate diets and they're super lean, super healthy, at least metabolically. So, yeah, those are some examples. And then you have a bunch of studies in the last few years where, higher carbohydrate diets do not necessarily lead to loss of fat compared to lower carbohydrate diets. So it's not the perfect model for sure. It doesn't fit all the data.
Right. And that makes sense. The quality of the carbs, the rest of your lifestyle, how you live the rest of your lifestyle, and sort of your baseline insulin resistance, genetics, everything gets boiled into one package that you can't just sort of simplify to one approach. But then this brings up another topic, though, because you're following the science, you're following the studies, but at the same time, it seems like if you rely too much on the science, you can totally disregard the personal experience that so many people have had. And that's an interesting balance to try and do, to say we're following the science, but at the same time honoring people's personal experience and understanding that different people react in different ways. So tell us how you sort of think about that.
Yeah, no, I think it's an interesting topic. Read it recently in a book by Nassim Taleb, Anti-Fragile. He has this very interesting story actually about low carbohydrate diets. He's a philosopher of probability research, etc. He's not a diet guru, but he's interested in that. But the point he's trying to make is that there is a clear difference between people's experiences of a diet, for example, and the sort of theoretical explanation that we use to try to explain why it works. So, for example, low-carb diets have been used for 150 years successfully by millions and millions and millions of people. People get less hungry. People lose weight effortlessly without counting calories. I mean, that's something real. It's very robust. That effect is there. Something makes it so that low-carb diets work. It's probably going to keep being the case. 10 years from now, low-carb diets will still work. 50 years from now, they will still work. But the explanation we use to try to explain why they work, that explanation can be quite fragile, meaning that, new science might show that actually this theoretical explanation doesn't fit the data anymore. And then the model may have to be updated. Doesn't mean that the diet doesn't work. It just means that the explanation of why it works wasn't quite, it was flawed. So I'm still as confident as ever that low carb and keto diets can be very effective for a lot of people to lose weight, eating foods that a lot of people feel are delicious and satiating and just, sustainable and great. So they are a valuable tool to use for the right person. definitely.
Right. I think that's a great point to point out the difference between that it works and why it works are two completely different questions and require different studies and different interpretation of the literature. And it's interesting, as on this podcast, we've interviewed quite a few different clinicians taking care of patients, and a lot of them sort of come to the conclusion that, look, I don't really care so much why it works. I care that it works so that I can use it with my patients. So as a website, as one of the leading sites for low carb and metabolic health and healthy weight loss, do you feel like you have to balance that message of that it works and why it works and kind of, I don't know, prioritize them in terms of what you're trying to help people with?
I'm hopeful that it's possible to do both. To say that, hey, this works, this is a proven method, lots of people really enjoy eating this way, and here's how to do it. It doesn't mean, I think, that you have to buy the explanation model that some people use to explain it if there is a better one. So I'm hopeful that it's possible to do both. And, you might say, well, who cares why it works if it works? Well, I think it matters, because if you understand, if you have a better model to explain why it works, then when people don't get the results they are hoping for, then you have a better ability to say, okay, let's tweak it like this to make it work even better. Let's say people get to a weight loss plateau. If you have a flawed understanding of why it works, then you may not be able to get past that. But if you
Right.
understand more closely, more in line with the best evidence why it works, then maybe you can make small tweaks that are, actually gonna get you to your goals in the most enjoyable way possible, right?
Yeah, that makes a lot of sense. So it does matter. It does help the clinician and the individual to know why it works as best you can to help make those adjustments. That makes a lot of sense.
Exactly. And then I think, what it comes down to when it comes to keto and low carb, the most common mistake that I think people do, well, it's a mistake if you're struggling with losing the weight that you want to lose, or improving your metabolic health as much as you want to. I think for a lot of people, it comes down to the amount of added fats. If you're adding a lot of, bulletproof coffee and a lot of, added oils to your foods, you're eating high-fat dairy and you're eating lots of nuts, which are, high in fats, then that may slow down your progress, and possibly reducing that a bit you might still be able to enjoy delicious foods, but you might also get better results. So that's, I think, one mistake people can do, because if you think that fat is kind of free food and doesn't raise your insulin, so it doesn't matter, then that might be misleading and might be holding people back.
Yes, that's a great transition, because now the message at Diet Doctor, which, let's be honest, initially was sort of eat as much fat as you want, right? That was a lot of what was on the website. And then adjusting to science and adjusting to clinical experience. Now, coming to the present, sort of transitioning to this message that you just said, well, you can overeat fat. So you do have to be wary of adding too much fat. Do you think that serves to confuse some people? Or, some people say, well, wait a second, I thought keto was just lower your carbs, eat as much fat as you want. Now you're complicating it, saying fat is bad, or I can't eat fat. So what have you seen about reactions to this sort of slight alteration in message?
Yeah, but there are some reactions like that, and I can see how it can be a bit confusing coming from one thing and then tweaking the message a bit. To be clear, I'm not saying fat is bad, and if people are getting the result that they want, eating as much fat as they want, then by all means keep doing it. It's all good. I mean, fat can be delicious and satiating, and it's more like if you're not getting the results that you want, maybe if you want to do something more, then maybe tweaking the amounts of fat down a bit and perhaps increasing the protein amount a bit can be a viable option. Again, if you're happy with your old keto diet, by all means keep doing it. I have no objections. I think it's fine. I'm not saying fat is dangerous or bad if you're getting the results you want. just that it's not free in the sense of weight loss. It's not like you can eat any amount and it doesn't impact weight results, because it does.
Yeah, I think that's a good answer. And I use the words fat is bad in the question more as sort of like to set you up for that, because I agree, it's not as well. And so I like the way you made that differentiation, because I think that's important.
Yeah, you might also say, some people need fat, depending on who you are. If you're at a good weight and health and you're an active person, maybe you need that fat to have the energy that you need and be satiated and be able to go a long time between meals. I mean, these are all good things. So I'm certainly not coming out saying fat is bad. I'm just saying if someone is struggling with getting the results for, health and weight that they want, then this is another lever to consider. That's all.
So here's maybe a little more challenging question. I don't know, but maybe, 5 years ago, Diet Doctor was clearly a keto website. Is Diet Doctor currently a keto website?
I think we're a low-carb website. We try to be the best resource in the world for information and tools and recipes and meal plans, et cetera, for everything low-carb. And that includes keto, absolutely. But it also includes, slightly higher carb options, like, maybe 80 grams a day, 100 grams a day, higher protein, moderately low-carb diets. Basically, Diet Doctor is for everything low carb.
How can someone who comes to the site understand, should I do a keto diet? Should I do a 100-gram carb diet? Should I do a high protein diet? Because again, if we get back to making the message simple, we have to be honest, nutrition isn't simple. So what can we do? What is Diet Doctor doing to try and help people understand where to start if they're confused?
So we have personalized meal plans. You can answer a survey on our website and get a suggestion for what we think could be a good option for you. We also have a lot of guides. I know you're writing one as we speak to guide people in this. I think we're going to build even better tools over time to help guide people to make the best choice for them. Probably a keto diet that is also relatively high in protein might well be the most effective diet possible for weight loss without hunger. However, it may also be challenging for some people to do. So it is going to come down to personal preference to a point, like how extreme, if you will, or how much of a change are you willing to do in the way you eat to get the best possible results. Maybe you don't need it. Maybe if you're just trying to lose 10, 20 pounds and reduce your risk of metabolic disease, maybe you don't need to go all the way to a keto diet. Maybe just going to 50 grams or even 100 grams of carbs would be fine. Maybe you don't have to go to a super high protein, 40% protein diet. Maybe 20% is all you need. It is ultimately always going to be a bit about personal preference and what people are prepared to do. So ultimately, you can't really say that there is one diet that is right for someone's health, because it's always also going to be about what do people like to eat, what are they comfortable with, what fits their lifestyle, sort of.
Yeah, that's such an important point, because again, it goes back to, does something work? Why does it work? And something may work wonderfully in a controlled metabolic ward for 2 weeks when all the food is provided to you and you're measuring different biochemical changes. But then when you're out in the real world and you have to cook, you have to prepare, you have to enjoy the meal, you have to enjoy the lifestyle, all of a sudden all those mechanisms kind of go out the window, don't they? Because it really is not going to work if you don't stick to it. So, and that's where we get into a lot of these battles, I think, the vegan battle, the vegetarian battle, the Mediterranean battle, the keto battle. There's so much that people argue about, whether it's about the science or, and people have their biases, people have what they enjoy. So how do you simplify that message to say, in this complicated world and the conflict that we see on social media, how do you simplify that message to say, find what works for you and stick with it.
Yeah, I mean that is probably true, right? You have to there has to be some kind of trial and error because it's impossible to say in advance exactly what you're gonna enjoy eating for the rest of your life, right? You're gonna have to try some things out, but there are some underlying fundamental first principles that kind of always apply, I would say. And if you reduce the amount of empty calories in your food, whether especially highly processed calories like sugar, processed carbohydrates, and perhaps also added pure fats. If you reduce that, you're always going to get closer to a diet that will allow you to have a good weight and a good health without needing to be hungry or count calories. If you go to a diet that is lower in energy density, more fiber, more vegetables, etc., and less highly processed foods, it's always going to be better from that perspective. If you avoid sort of ultra processed foods that are highly rewarding or even addictive, like donuts and chocolate and ice cream, or at least maybe try some better versions of that, then that's always going to be better as well. So, but then if you want to eat mostly vegetarian or some kind of Mediterranean style or anything else, I mean those things I think are more people's preferences and other reasons. People may want to be a vegetarian for ethical reasons or for any other reason. Maybe they just prefer it. I think those are personal choices. Yeah, so I guess I'm rambling a bit, but people have to find clearly what works in their life. But there are underlying fundamental principles that can help guide you when it comes to maintaining a good health and a good body weight without being hungry, without having to count calories or restrict your food intake, just by eating better foods. And that's, I think, where we can help out.
Yeah, a number of good points there. And the key one being all of these diets start with the same principles. All the successful diets start with the same principles, just like you're saying. And if the majority of the population focused just on those underlying principles, we dramatically improve our health as a population. But then some people are going to gravitate more towards, you could say, the extremes, whether it's keto or whether it's full plant-based or whatever the case may be within those principles, based on their taste, based on their personal preferences, and also based on some of their underlying health conditions. Because it does appear, maybe a more quote unquote extreme keto diet might work better for some health conditions. Whether it's bipolar disorder or migraine headaches or type 2 diabetes on insulin. So some people on the extremes would gravitate towards those, but the majority is just right in that bucket of the common ground, sort of like you said.
Of course, from our perspective, our core competence and where we have the most resources and recipes and meal plans, it is different kinds of low carbohydrate diets. It's not the only way to do it, but it's one very effective way. And it's also one very effective way that for a lot of people is very enjoyable and delicious. Yeah. So I think it's a good place for us to start, but we're certainly widening kind of our options more and more.
Yeah, widening our options, but still sticking to that other point that you mentioned, that we still have to address hunger. We still have to address satiety. We still have to address the emotional part of eating and lifestyles. So what have you seen change in the landscape of nutrition over time as we talk more about that? Because let's be honest, when you go back to the original dietary guidelines, it seems like nobody was talking about that, right? It was just eat this is the best diet, and if you're hungry, deal with it, right? So what have you seen change over time in the landscape of nutrition and how low carb has fit into that?
Yeah, I mean that's a great question. I think that is why the calories in, calories out model is so flawed, because it doesn't really put the focus where it should be. You look at studies showing that depending on what kind of macro split that people eat, meaning carbs and fats and protein, there can be so much as 3x difference in how much food you want to eat. So if you're eating as much as you want to of ultra processed fast foods, very low nutrition, very low protein, basically the donuts, the pizza, the ice cream, and the chocolate, then you're gonna probably eat almost 3 times more calories on average compared to if you go on the extreme other end, which is like a ultra high nutrition diet with high fiber and low energy density. Basically, chicken breast and broccoli, the stuff that the really, really, really boring food that fitness professionals and Hollywood actors, when they are going to be superheroes, that's what they eat. So there is a 3x difference there, and if you just talk about calories, you completely miss that picture.
Yeah.
But if you go to the extreme end and you eat salmon and broccoli or chicken breast and broccoli, you don't have to count calories. I would argue you're never gonna be able to eat enough to become gain significant weight, or at least I challenge anybody to achieve that. I think it's almost impossible but if you're only eating ice cream and potato chips on the other hand, then you're going to have some severe problems. No matter how many calories you count, how much counting you do, you're still going to struggle to maintain your weight. Probably most people are going to find it impossible to do. So this just goes to show, right? It's not about whether you count calories or not. It's about the foods you eat.
Right. Yeah, that makes a lot of sense. So I think we've done a good job to this point of talking about the past of Diet Doctor, what has sort of transformed and transpired to bring us to the present of Diet Doctor, following the science and following the different more nuanced complexities of nutrition science. What do you see as the future of nutrition science, of healthy weight loss, and how does Diet Doctor plan to fit into that future?
I think that the future is moving beyond this sort of oversimplified focus on calories in and out. And if you look at these, services for diets and weight loss and apps and so on, they're so focused on calories still. I think that there has to be a better support for people to make it simpler to eat good food. I mean, it's such a challenging environment we're in today. If you just eat a little bit of everything, you end up with a pretty terrible diet today, unfortunately. And if you're going to make up for that by counting calories, that's going to be very hard. So anyway, where I see us going is, yes, we want to be the best resource in the world for low carbohydrate diets, but maybe expanding from that to other kinds of diets, higher protein diets, other diets, be a great tool for people to use in figuring out, what am I supposed to eat then to be healthy, and foods that are simple and fit my budget and that I really enjoy. That is what we're developing more and more tools for, and also tools for professionals such as doctors, coaches, personal trainers, etc. It is super hard. I know. I'm a doctor, and I know we may have 5 or 10 minutes with a patient. It's just almost impossible to effectively support people for this. So we need tools, I think, to leverage to be able to do that effectively with patients and clients. Same for coaches and personal trainers, etc. when it comes to the diet part. So we are developing tools for that and support for that. So it's that I think is super exciting.
Yeah, that is exciting because I can think back, to my medical practice when you're in a big group setting, but you really have no ancillary support for nutrition, for lifestyle changes. You don't have somebody who really gets it and can spend time with the patients. And so you have to send them somewhere. And the question is, where do you send them? Where do you send that patient to find the best information to help them with that lifestyle that works with sort of your beliefs as a doctor as well, and is trustworthy? Because let's be honest, there's so much that people can find on the internet where you don't really know where the information's coming from. So I think having that resource as a clinician would have been fantastic for me. So I'm excited to help develop this to help clinicians. But what's also interesting is there's a wide variety. Right now, we're seeing these direct primary care practices pop up, which tend to have more of these resources. And we're seeing, nutritionists and personal trainers getting sort of more involved in this. So it's interesting to think of the landscape to how to support all of these different clinicians and practitioners. So I guess I'm not sure what the question is other than to acknowledge that there's this wide range out there, but it's great to have a resource that can help all of those different clinicians in some way, because they each are going to have different things that they need to reach their clients and help their clients. Because in the end, that's what it's about. It's about helping their clients succeed and helping sort of the clinician do it in a way that is more convenient for them. So it's sort of a leading question, but I guess this is part of where Diet Doctor is going, to try and develop these tools to help the clinicians in the best way possible.
Yeah, absolutely. And it really connects to all the content we already have, all the recipes and meal plans and the personalized meal plans, etc., and the tools we have for any user, making it possible for these professionals to leverage all of that with their clients, with their patients, is part of it for sure.
Yeah, and part of the message that I think is important to get out there is for the individual to know when they see their doctor, their personal trainer, their nutritionist, their health coach, when they see that person, to be able to say, hey, check out Diet Doctor, check out what they're doing. What advice would you give people how to sort of explain to their clinician if they're not quite on board with low carb, or they think keto is just a fad that is going to pass and is dangerous? What advice do you give to the individual to talk to their clinician to sort of get them started and open their mind a little bit about this?
Yeah, so we have a lot of resources already at Diet Doctor for clinicians, where we go through the science, we teach clinicians how to do this in a safe and effective way. We even have CME approved course for doctors. And we're coming out with a program for people who want to become better at coaching people in low carb and how to do it effectively and safely. So we're also developing educational material, and we already have a lot of that. So I think it's a good place to start for doctors. Certainly, I'm not aware of any place where there are better resources available to learn about this from a medical point of view.
Yeah, you're talking about all these resources, and there are some great resources. And what's interesting though is trying to take the resources that can apply to so many people and boil it down to that one individual person and that personalization part of it, which can be challenging, right? Because that's when you get into these more specific questions of, well, should you be eating, low-fat dairy or high-fat dairy? Should you be eating more carbs? And if you do you risk coming out of ketosis? Is that a good thing or a bad thing? You can really get down to some very specific questions that can be difficult to answer with sort of, general guide. So how do you see kind of boiling down that general advice to the more specific advice for the individual for these types of questions?
Yeah, it's of course challenging to do. I mean, we are going towards more of a personalized approach on our website where, based on what people can share with us in surveys, etc., we can then provide, personalized food and recipe recommendations. We already have personalized meal plans, personalize the content that we recommend people, also like an onboarding format and so on. So, I mean, we're certainly moving more and more towards a personalized approach. But when it comes to, should you eat a high-fat dairy or not high-fat dairy or even low-fat dairy, I think that is ultimately the answer is, unfortunately, it depends. High-fat certainly is fine, and if people are happy with the way that tastes and the results that they get, then maybe that's the place to be. If they're struggling, with losing weight, for example, maybe reducing that can be a smart thing to try out to see if they can enjoy a less high-fat version of dairy, to see if that can speed up weight loss. Again, it depends. And on the other hand, if you have someone who is, healthy and lean and very active, then maybe they actually need that energy to feel their best. So maybe in that case, it's a great idea to go with the higher fat versions.
Yeah, it's interesting to think about, when you start promoting low carb foods, keto foods, and one of the main messages is high fat is not dangerous. High fat is not bad. But then that can be turned around to saying low fat is bad. And I think if you focus only on low fat foods, then yeah, you might get into trouble because you're going to be hungry and you're going to be sort of, white knuckling your willpower, so to speak. But it's not that one is good and one is bad. It's like they all play a role. And I think we get into trouble when we polarize and say high fat good, low fat bad, or the opposite. And so that's maybe what the message should be showing, but also can confuse people if they don't sort of get the granularity of it.
I think actually something that I find interesting is that if you go with a sort of generic low-fat message, fat is bad for you, then maybe the problem with that, or one of the main problems with that, is that it tends to result in people eating less of very nutritious and high protein foods, like you eat less meat, you eat less fish, less eggs, etc., maybe less dairy, and now you suddenly you not only are you eating lower fat, you're also eating way lower protein. So I think it is possible to eat a good low-fat diet, probably. But the main problem may be that if people just approach the sort of low-fat message as in, all these foods are dangerous, then they get rid of many of the most nutritious foods, and they can gravitate towards, sometimes quite, highly processed foods that are very low in nutrition, but low in fat, and if that's what you do, I think, low fat actually probably is bad, right? But if you go to, let's say, you eat more vegetables and more beans and lentils and that kind of thing, then maybe that's just fine.
Yeah, and differentiating a complete low-fat diet versus low-fat foods, those are two different things as well, because low-fat foods can play a role in a high-fat diet even, or in a high-protein diet or a low-carb diet. Those low-fat foods can still play a role, and that's very different from saying a low-fat diet as well. So I think that differentiation is important.
I think it again comes down to sort of what is the kind of explanation model we use here, because yes, a low-fat diet can actually result in eating less nutritious foods and that you become more hungry and that you actually end up eating worse foods. But it doesn't have to. It just depends on how you do it. And vice versa, a low-carb diet can often result in, and indeed, this is what studies show usually happens, is that people tend to eat more nutritious foods, more protein, more other nutrients. But again, that's not necessarily the case. You can also imagine a low-carb diet that is just lots of added fats, bulletproof coffee 3 times a day. That's a low-carb diet, but probably not a very healthy way to live. So again, it's about how do you eat the low-carb diet? How do you eat the low-fat diet? It's just more complex than just saying it's all about low carb, high fat, or vice versa. It's not, right?
Right. And I think that's a great way to summarize it. And this has been a great discussion. I've really enjoyed talking about all these topics with you, and I hope our listeners have enjoyed it as well. And not just to talk about Diet Doctor, what Diet Doctor's done, but basically how Diet Doctor has fit into the nutritional landscape, how it's changed, commitment to science, but still commitment to the individual, and trying to get that information out there as best we can. And although maybe making low carb simple meant one thing in the past, and is sort of changing what it means, it's still the idea of finding what works for the individual and doing it in a way that they can sustain and enjoy. And sort of that's the simple message. And then if it's working for your metabolic health, to stick with it. So I really appreciate you taking the time to come on the podcast and share your wisdom, because I know our listeners really appreciate it.
Well, thanks a lot for having me on. And what we do is it's all about what works, really. So following the science is it's about finding what it is that works the best for people, and then trying to make that as simple as possible.